Good morning, everyone. Welcome on into North Dakota today. We are gearing up because National Wear Red Day is this Friday, February 2nd. The American Heart Association is asking you to support the Go Red for Women movement by wearing red. Jessica Lundgren of the American Heart Association and Ashley Johnson from Sanford Medical Center are joining us this morning to tell us all about it. Good morning.
Good morning.
Good morning.
It's wonderful to have you both here.
Thanks for having us.
Thanks for having us.
Yeah, a big end to our week this week. Why are we going red?
So we go red every year. February is National Heart Month. February 2nd, so this Friday, is National Wear Red Day. We are raising awareness for cardiovascular disease and bringing light to how people can prevent cardiovascular disease.
And how important is this?
Extremely important. It is the #1 cause of death in the United States.
Wow.
70% of cardiac events happen outside of a hospital. So that's why we're kind of so impassioned about this project and getting everybody to know the tools that they need to learn to possibly save a life.
Yeah, so not just nationally, but regionally. This is affecting everybody, huh?
Yes.
So how can individuals and businesses kind of participate or get involved in any way?
Yeah, so again, this Friday, National Wear Red Day. Wear red, spread the word at your business. Wear red at your business. You can participate. One really important thing is learning hands-only CPR. It can save a life. And then really to help what we do at the American Heart Association, which is provide research, cardiac research, is to give. If you're able to donate, that is how we're able to fund research. And when I say fund research, I mean right in town. We are currently funding 3 research studies at NDSU, totaling just about $600,000. So what we do locally in Fargo here, it impacts all of us.
That's incredible. Thank you for bringing that into perspective too. So how important, I know I already asked this, but specifically for men and women, do you find that maybe women are getting checked out more versus men, or what are we kind of seeing? Why is it such a big deal?
I think one of the things that is really important to understand about heart health in general, you know, a lot of people, symptoms of a heart attack can be very different, not only from male to female, but just person to person. So, you know, you always hear symptoms, people complaining of, you know, heaviness, like an elephant is sitting on your chest. Those are the things we're kind of used to hearing about. Some other signs, though, in women especially, feeling of indigestion, just a general overall sense of not feeling well. I always say, you know, nobody knows your body like you do. So if you feel like something's not right, get it checked out.
Absolutely.
So where can we go for more information, and remind us again why we're wearing red?
Yes, so for more information, you can go to heart.org. You can go to Sanford Health's website. We have a great partnership with them this year around hands-only CPR. And the importance of wearing red this Friday is to raise awareness, to learn to take care of your health, and learn hands-only CPR.
Yeah. Was there anything else you wanted to add?
No, I just like to circle back and just really say, listen to your body, listen to your body. And the more people that learn CPR, the more likely you are to help in that time of need.
Well, thank you so much for that information, but the fun doesn't stop here, you guys. We're actually sending the girls over to Sophia here in studio to walk us through that live CPR demonstration. So we'll go ahead and get everything set up right about now. So if you guys want to walk on over, we have Soph holding down the fort over there. And yeah, so we're going to be taking a look at the hands-free demonstration. Take it away.
Hi, ladies.
Oh.
Great to see you.
You too.
All right, so what are we getting into today?
So currently we have a partnership with Sanford Health, the American Heart Association does. Sanford Health has been extremely generous and have contributed 48 hands-only CPR kits to local businesses in our community to spread the word and teach so many people the life-saving skill of hands-only CPR. The idea with this is that a lot of people are scared to do CPR because of the mouth-to-mouth, and they're worried about legal repercussions. But in all honesty, doing anything is better than doing nothing. And what we've talked about is life over limb. So if you're scared you're going to hurt somebody by doing CPR, it's better to save their life and them have a couple broken ribs. And so we are spreading the word and teaching as many people as possible about hands-only CPR.
Okay, so hands only. When I was a lifeguard, you know, we learned the mouth to mouth and then the hands. So this is different, correct?
This is focusing solely on the compressions.
Okay.
So if someone near you were to become unresponsive, it's very simple, 2 steps. You find somebody, say call 911, and then you press hard and fast.
Okay.
100 to 120 beats per minute.
Okay.
which a lot of people think, well, I don't know what that is. And we think of the traditional song Staying Alive by the Bee Gees, which is a little ironic.
Yes.
But also the American Heart Association has a playlist on Spotify, if you have it, called Don't Drop the Beat. And there are tons and tons of songs on there, everything from REO Speedwagon to Taylor Swift to Prince and everything. So
Yeah, so that's certainly good to know. Okay, so walk me through this. How do we do it?
okay.
So first you want to find the center of the chest, and you're going to place kind of the heel of your palm, the butt of your hand, right there in the center, and you just use your upper body, and
Oh, yep, that's hard.
it is hard,
Okay.
and you keep going.
And you sing a little song to yourself, right?
Yep.
That's it.
Exactly. That is perfect.
You will
Okay,
be
perfect.
hot and sweaty when you're done.
Yes.
Yes.
What we find is that 90% of people that suffer a cardiac arrest outside of a hospital do not live.
Wow.
70% of those cardiac arrests happen in the home. So it's really important for everybody to know this. And only about 40% of those people receive some sort of bystander care before
Wow.
professionals arrive. So if we can increase those numbers, we can save lives.
Yeah, absolutely. So is there any special kind of certification that you guys offer for this?
Good question. So there is traditional CPR certification that a lot of jobs require, and that is something you will have to have a certificate for and be formally trained. Hands-only CPR is something anybody can do,
Okay.
and again, can double or even triple the odds of saving a life.
Wow. Well, yes, this is certainly good to know. Anything else you'd like to add?
You know, at the American Heart Association, we want to really thank Sanford. You guys have been very generous in helping us provide these kits to the community and spreading the word about it and creating a nation of lifesavers.
Yeah, thank you for working with us. It's an important project, saves lives.
Absolutely.
Well, yes, we certainly learned all about that. Well, thank you guys so much for sharing this with us.
Thanks for having us.
Yes, of course. All right, everyone, stick around. We have more North Dakota Today coming up after the break.